Hello all, this is Dr. Dheeraj Masapu. I am a consultant anesthesiologist and today I am going to tell you the Indian growth story. Healthcare sector at present valuation is around 372 billion US dollars and it is growing at a rate of 22% and it is going to increase to a level of 1 trillion within a period of 7 to 8 years according to calculation. So what are the main reasons driving this kind of growth in India? I am going to tell you. So first reason would be FDIs, foreign direct investments. So many international companies are trying to invest in India because they understood that growth is going to happen here, and many companies are investing in the form of corporate hospitals and they are increasing the chain of hospitals, and we are seeing those hospitals. I don't want to go into details of which hospitals are funded by international companies, and government has allowed 100% FDI policy in greenfield projects. So that means any foreign company can make 100% hospital of their own in our country. So government has given approval for that. So lot of hospitals will increase in metros and tier 2 and tier 3 cities. So, and the next reason would be the government spending. Government has increased the budget allocation by 2.7% and 88,000 crores in 2023 budget. So how does this translate? So how does this translate is, that Ayushman Bharat scheme is coming up, Pradhan Mantri Yojana scheme. In that scheme, around 5 lakh rupees is granted for each family for any tertiary or secondary healthcare service. So if somebody is coming for a surgery, 5 lakh rupees is there with them now. So they can actually, previously unaffordable patient can now afford a good hospital wherever he wants to go, in a tier 2 city or a metro. He can choose based on the expenses on the type of the disease. So this is another reason. And number 3 reason would be the medical tourism. There are 46 destinations for medical tourism in the world, and India is ranking 10th in that. The reason is affordable pricing. So for a cardiac surgery, in USA it would cost some X amount. In India it will be done by 1/10 or 1/15 of the price of that. So this affordableness is attracting many international patients to India, and it will increase in future. So I don't expect a person from USA to come to India, but there are many countries, even though they are covered by health insurance, they can't afford the kind of health care in developed countries. So they might choose India because within the health package they can finish the surgery and they get the same quality of care here. You have the best surgeon, you have the best equipment and the best quality of care. So what we need to focus on developing the quality of care in India to develop our healthcare industry from 372 billion to 1 trillion by 2030. So as a doctor, so why I told you all these things? So as a doctor, how should I place myself? You ask me. What I am going to tell you is, there are 2 ways you have to place yourself. Number 1 is, if you are interested to stay in metros, whatever may be the reason, maybe lifestyle or kids education, or maybe you are from a metro, then you need to think about staying in corporate hospitals, because in future what is going to happen is, more and more FDI investments will happen in corporate hospitals, and chain of hospitals will be there in every corner of the city. So if at that point of time, if your degrees are suitable for a corporate hospital, then it will be very easy. So what are the degrees? DMs, MCHs, foreign degrees, FRCS, MRCPs, this kind of degrees are very attractive in corporate hospital, attractive for the corporate hospital management, and also patient would consider these degree patients when they are going to a corporate hospital. So I think you should invest more time in educating yourself and developing skills which are required for a corporate hospital. If you are planning to stay in city, no, I don't want to stay in city, I want to stay in tier 2 city or a town, then my suggestion would be, you plan to build your own hospital. So how to do that is, first you have to go to the city, and then you don't waste your time developing your degrees there. You develop a basic skill set, go to a town and develop a patient base. That is more important. When you have a patient base, then you can show this patient base to a investor, like a venture capitalist or maybe a foreign investor, or maybe a lot of NBFCs are also coming with investments. So if they see that you have a patient base, they would be ready to join hands with you, and you can develop a kind of a big hospital along with them. And only thing you need to focus is, at present what I feel is, the quality of healthcare is not comparable with the cities. So whatever is seen in the towns and tier 2 cities, there is a lot of gap at present. But if you can try to decrease that gap, there is no reason for a patient to move from a tier 2 city to a metro. So that is what you need to focus, I feel so. So if you can liaise with big companies and venture capitalists and get the same equipment that Metro Hospital has, and get the same kind of nursing care and the quality of care and the ambience that if you can create in a tier 2 city, patients would stay there and they would not go to a metro. And another major advantage that tier 2 cities have is the surrounding villages. So surrounding villages a village person would always like to go to a town which is nearby rather than going to a metro hospital. So that is a very key advantage you have. So to summarize, if you want to stay in a city, try to develop your skill set, degrees, and try to be a more attractive a person for a corporate hospital. If you plan to stay in a town, try to develop your patient base, try to liaise with a big company, and try to make your own setup. So if I am in between, then what should I do? If you ask me, if you are in between, if you are not like we are an anesthetist or radiation oncologist, or if you are a microbiologist, pathologist, or a nuclear medicine, or if you are a community medicine or some other branch, then what you need to do is you are a supporting branch, so you need to up your game. You need to develop the skills which are attractive for these two setups. You also have to choose. For example, if I'm an anesthesiologist, if you plan to be in a metro, then you have to go for DMs and training in several countries and come back and settle. If you plan to be in a tier 2 city, then maybe you have to liaise with good surgeons and then develop a good contacts with the surgeons and try to develop the same quality of care that is available in metros in this particular town. So this is how I think you should position yourself with, and I think when the growth story is happening, you should be in the right track. Don't lose in the growth story. That is what I am trying. Try to be smart and intelligent, and when the 372 billion is going to become 1 trillion, I want you also to be part of the growth story and you succeed in your life. That is why I am doing this video. So reason why I did this video is many people are actually thinking and they're going away from this country to other countries, thinking that India is not a good place for them. See, but they are not understanding the kind of growth story that India is going to have in the next 7 to 8 years. So please understand and stay within the country and be part of the growth story. And because we need intelligent and smart people to lead, intelligent and smart doctors to lead the growth story. Thank you very much for following the video, and as usual, Dr. Dheeraj Masapudheeraj logging off. Roger that.